The CEO of the Millennium Heights Medical Complex has taken leave after the end of his contract, which will not be renewed. Health Minister Hon. Moses Jn Baptiste, in a recent statement, confirmed that while the CEO has made significant contributions to the institution, his tenure has come to an end.
We know that from time to time, professionals decide what path to take, or various boards of governors decide what path professionals, what kind of professionals, or how their journey will be with professionals. This happens in many organizations. Professionals who work at organizations do not always stay. Neither do boards of directors always agree to continue with certain professionals. But I am not aware that the CEO has resigned. This is not factual as far as I know.
Minister Jn Baptiste acknowledged the CEO's role in advancing the programs at Millennium Heights and stated that the board of directors is playing a key role in managing the institution.
The board of directors would have sat with the CEO and a decision would have been made. I believe that there is a lot more that needs to happen at the Millennium Heights Medical Complex. The hospital is about 4 years old as a complex, as a Millennium Heights Medical Complex, having moved from the respiratory hospital or the Victoria Hospital. And so we are working very hard with the board of directors.
He further noted that the current board of directors term will conclude in November 2024. The government is actively working with the board to ensure continued development at the Millennium Heights Medical Complex, alongside securing adequate funding for the Owen King European Hospital and St. Jude Hospital. According to the health minister, the government inherited inadequate funding for these institutions and is currently working to address the financial shortfalls.
The whole healthcare system over many decades have not been properly financed, and this is what we are working on. We know, for example, that although we have increased the subvention to the Millennium Heights Medical Complex over the last 2 years, that it requires over $100 million to run the hospital. We know that the St. Jude Hospital, although we have increased the subventions, it requires even more, possibly over $43 million to run that hospital. When we move to the Auger site, the costs will have to be revised.
The minister emphasized that the government has already increased its financial expenditure and is collaborating with the boards of management at the various medical facilities to ensure proper administration and continuous improvement of healthcare services. Shelton Daniel reporting for NBC News.